Tuning in. So we are moving into our expert discussion for today. And today we are discussing a disease that continues to affect millions of women around Uganda and around the world and thousands of families here in Uganda. And this is breast cancer. So despite the advancements in medicine and also improved awareness, many women nowadays are still diagnosed late and often because they do not realize or recognize the warning symptoms, the fear the disease. But breast cancer is not a death sentence. So when detected early and given treatment early, it can be when treatment is given early, it can be highly effective and save many lives. So today, in this discussion, we are going to learn how it develops, the risk factors, the early detection through the breast examination, and also the available treatment options, whether it can be cured or what hope exists even after the disease is diagnosed. So to help us understand better, we have been joined by very important people, and these are experts coming into ours to tell us what exactly breast cancer is. And these are none other than Mrs. Gertrude Nakatude, and this is the CEO for the Women's Cancer Support Organization, and who has worked closely with breast cancer patients and the survivors. And apart from her, we have been joined by also a very important person. This is Dr. Biku. He's a retired breast surgeon from the United Kingdom and who has dedicated many years to treating breast cancer, the treatment and also education, plus training many people across different countries and including here in Uganda. So stay with us, and this is going to be a very important, informative discussion and also a life-changing discussion. So stay with us as we move further. So you're most welcome, Doctor.
Thank you very much.
Thank you for coming.
Thank you.
You are most welcome, Ms. Nakatude.
Thank you so much.
And thank you for coming, Gertrude. Sorry. Okay. And thank you for coming again here on TV1.
It's my pleasure.
To not waste any more time, let's just get into the discussion.
Sure.
So let me start with you, Doctor. What do you think breast cancer is? When someone talks about breast cancer in your terms, how do you define it?
Well, breast cancer there are many types of cancer.
Okay.
And the breast cancer is the type of cancer women get in their breast.
Okay.
Now, this is common in women because women has got breast tissue.
Yeah.
But for every 100 women, 5 men in this country also can get breast cancer.
Okay.
Okay? And so what is cancer? The cancer is our body's cells grow every week.
Okay.
And our skin cells get changed within 2 years completely.
Yeah.
The skin cells I had when I was a baby and now is very different. Even now, I'm old, it will continually change.
Okay.
My nails grow every week.
Yeah.
But next week, it will not suddenly grow that big, and suddenly it will not start growing in my eyes or ears.
Okay.
So that is cancer, when some part of the body's cells grows without control.
Okay.
And then those cells, because they're out of control, not only spread locally and get bigger and bigger, cause discomfort later on and other problems, but also can go to the other vital organs of the body, like brain, lung, liver, and kill the person.
Okay. Also, Doctor, how does the breast cancer actually develop in of any person? Because you said it can be through the male, also the female. So how does it actually develop?
Well, breast cancer is, in a way, as I said, the cancer cells gradually take over one part of the body. And cancer can happen in many parts of the body. I'm here to talk about breast cancer, which is not related to any infection.
Okay.
Unlike cervical cancer, it is not related to infection. And because of that, there is no vaccine.
Okay.
There's no vaccine for breast cancer now or even next 30 years anywhere in the world.
Yeah. Okay, so you said it in your when you were explaining that it comes when like there are abnormal cells coming up. So how long does it take for someone to like get to know that now the symptoms are starting to come?
There are many types of breast cancer. Some breast cancer grows very rapidly.
Okay.
Within a very short period, if it is not treated properly, kills the person. And some breast cancer by nature, they actually grow slowly and takes time to kill the person.
Okay.
Okay?
Yes.
So there are many types of breast cancer. Okay?
Yeah. Okay, maybe I think let's just get into it, the types of cancer. But to begin with, let me just go straight to Miss Gertrude. So we have talked about like some of the symptoms coming in, like very many people starting to like receive different types of symptoms. What are some of the cases where you've seen like people getting the symptoms like different from another? Like, if you could go into that, like.
Thank you so much. As Doctor mentioned, that there's so many types of breast cancer. So I think each type presents differently.
Okay.
So when cancer is starting, you may not know because the symptom is not visible, like a lump. He will explain more to that because he's an expert. Some women get lumps, small lumps, but you can only feel that lump when you touch. You cannot see. Some women get bloody discharges in the breast or water. Some get rashes, but some of those are late. Most of the time you may not be able to see some of the early signs unless you have really taken time to check or to feel whether you have a swelling in the breast or not.
Okay, thank you very much.
The breast cancer,
yes.
What God would say is absolutely, I want to stress that breast cancer is known as a silent killer because in the beginning, the breast cancer starts as a lump in the breast, like a little rock, which you cannot see. Only if you feel, if you examine your breast.
Okay.
And even at the late stage, by the time it has grown really big, it does not cause any pain.
Yeah.
And that's why it's called a silent killer. And breast cancer, other changes happens as the time goes on.
Okay.
So if you have got a cancer in the breast changes shape and size, nipple gets pulled in, and breast looks deformed. But those things are much later.
Okay.
The first thing to think about is a lump which does not cause any pain. You cannot see it. You can only feel it if you examine yourself properly.
Okay. So, Doctor, you had talked about the types. I think let's first get into the types of breast cancer. What are some of the types that are out there for breast cancer?
This is the commonest cancer everywhere, even in Uganda. Okay? In Uganda, the breast cancer is no different from anywhere in Africa.
Okay.
Only difference here is the breast cancer in Uganda and for African women happens at a much younger age.
Okay.
Okay? Whereas breast cancer is common as you get older and if you are female. But in Europe or America, breast cancer rises from age 40 onwards.
Okay.
But here, it's not uncommon to have women breast cancer in their 20s. I was in a place, Namishanda district, Namishanda.
What? Namisimbwa.
Yeah.
Namisindwa. Okay.
Yeah, I was there last week, and there we found in a group of only 30 people I was training, village health workers.
Okay.
There are more than 12 has come across breast cancer.
Oh my God.
And quite a few of them were 20-year-old, 22-year-old.
Okay.
And sad thing in Uganda is almost all of them died within 1 or 2 years. Only one person survived 4 years.
That's
she was
so
45.
sad.
And that is the sad story.
Yeah, it is. So I think that brings us to a question like, who is mostly at risk of receiving the breast cancer?
Okay. So what are the risks of breast cancer? The risk of breast cancer can be classified into two. One is the risk factor you cannot change.
Yeah.
You cannot change being a female. So
Yes.
your risk is higher than a man.
Of getting the
Okay.
cancer. Yes.
And also your family history.
Okay.
If you have got a family history, you have got mother or sister or your brother or father had breast cancer before the age of 40, your risk goes up.
Yeah.
But the family history is only less than 1 in 10 of all breast cancer.
Yeah.
So these are the risks you can't change.
Of course.
But the risk you can change is number one, lifestyle.
Okay.
And in the lifestyle, most important is alcohol.
Yeah.
World Health Organization describes alcohol as the biggest risk factor for breast cancer.
Why
And also-
is that? Yes.
It increases breast cancer risk by almost 30%.
Okay.
Now, there is no type of alcohol which is safe. And the WHO says that alcohol, the risk starts from single drop. And it's not only breast cancer, but also 7 different type of cancer in man and women.
Women, yes.
And also prostate cancer in man
Yeah.
happens because of the alcohol. So that
Okay.
is a lifestyle you can change.
And
You are-
before we go any
Yeah,
further,
yeah.
how do you relate the alcohol to the breast cancer? How does
Any
it?
cancer.
Okay.
Because alcohol produces a substance when you drink any type of alcohol, any amount of alcohol.
Okay.
It produces a substance, it's a chemical substance which damages the body's DNA, that is the cells which is responsible for multiplying, keeping us
Okay.
going.
Yes.
And once it is damaged, there is a potential for that to turn to cancer. Not tomorrow if you go and drink tonight, but in future you are
It will-
running the risk of developing cancer.
Yeah.
The second thing actually also WHO says is obesity.
Okay.
As women are getting more obese in Africa, breast cancer risk is going up almost by 25%.
Yeah.
And also obese women have got higher risk of diabetes, blood pressure, heart disease, and stroke.
Okay.
On the other hand, women who does extra physical work, I'm not talking about, oh, I had a very busy day.
Yeah.
I'm
Yeah.
talking
Sure.
about on top of that,
Yes.
2 hours extra physical work every week. That means running, jogging, cycling,
Yeah.
or
Sure.
climbing up and down
And
the
down,
stairs. That can reduce breast cancer risk by almost 20%.
Okay. So.
So
it's-
obesity and alcohol is the most important.
Yeah. Sure.
Okay?
Yeah, sure. Okay. So, doctor, moving forward, why do you think our examination is highly important?
Okay. So how does women know they have got breast cancer?
Uh-huh, of
Well,
course.
as I said, the breast cancer is a painless killer,
Okay.
silent killer. So unless you examine properly, you cannot find breast cancer until very late.
Yeah,
Okay?
sure. Yeah.
And for examination, we advise, because breast cancer happens here from a very young age,
Yeah, sure.
and by nature, breast cancer in this part of the world is more aggressive in younger person.
Than older people.
So we advise all women from age 20 to examine their breast once a month,
Okay.
so that they know their own breast, so that there's any change they can spot it,
Okay.
and then go to have looked at properly.
Yeah, sure.
So if you have got time, I will very briefly show how to examine yourself.
You know, it's okay. We can actually do that demonstration.
Is
how
that
to-
okay?
Yes, it's okay.
Okay. So the first thing is having a look, and if you are looking, if you have got a mirror, good. Otherwise, it does not matter.
No, it's
Then
okay.
raise your hand like that. Okay. And then have a look at both breasts. They're equal or not. Now you need to remove all your upper body clothes to do it properly.
Okay. Yes.
That's why privacy is important.
It's highly important.
Now
yeah, sure.
all women knows your breasts are not equal.
Okay.
Sometimes one breast is bigger than other.
Yeah,
But
sure.
you need to know that from the beginning if there's any change.
Okay.
And the second thing to do is go like this and see if the breasts are moving equally.
Okay.
That's
Yes.
the first thing. But as I said, more than 90% of the time, you cannot see until it's very
Okay,
late.
about if they are moving properly,
Yeah.
like how are they supposed to move? Because we need to understand
breast
that better.
tissue moves as you move because breast is
Uniformly.
not attached to the muscle. It's in front of the muscle.
Okay.
So it moves, and both sides usually will move equally.
Hmm.
So you need to know if there is suddenly one breast is stuck, another
Stuck.
breast is moving.
Okay, yes, then
Yeah.
yes, that is
next
something we
is,
can understand. Yeah.
As I said, that if you just look, you will miss many cancers.
Okay.
Okay, until very late.
Okay.
So the next thing is to check that, put your hand up, and if you see your nipple is pulled in. Okay.
If your hands
Nipple
are
has
up.
gone in, hands
okay.
up.
Okay.
Okay.
Yes.
And some women from the very beginning has got their nipple pulled in, or some women after pregnancy has got nipple pulled in.
Yeah,
But
okay.
you need to know if it is new change. That could be sign of a cancer.
Okay.
And then more importantly, that you need to feel your own breast.
Okay.
So looking alone is not good enough. You need to feel by touching.
Yeah.
And for feeling, we advise to use 3 fingers, middle fingers.
Okay.
Not examine breast like this, never. Okay? You need
Yes,
to do it systematically.
Okay.
So for right breast, use your right hand.
Okay.
Okay, left breast,
I
right hand.
okay.
And right hand, use, remember the breast tissue starts from this bone, collarbone,
okay.
just below that until abdomen.
Okay.
Okay? And also goes under the armpit.
Okay.
So we advise that use your flat finger, start from the top, go like a circle,
Okay.
all around, and make smaller circle, smaller circle. Now, if women has got smaller breast, they use light pressure.
Okay.
And if they have got bigger breast, they need to press a bit harder.
Okay. So
Okay.
to feel, yes.
So you need to feel. And then breast tissue goes under the armpit as well.
Okay.
And also there are glands. So to feel that, again, with the opposite hand, feel under the armpit.
Okay.
And exactly opposite on the right breast, put your hand and then
Feel.
go like a circle, go like a circle, go like a circle to the nipple and then under the armpit.
Okay.
And if you feel anything different, then get advice.
Okay.
If you are not sure, then you need to come back within a month. And the best time for women to examine their own breast is 5 to 6 days after the menstrual period stops.
Okay.
That's the best time.
Yeah.
If you examine any time, you will find lots of different things which disappears after the period.
Okay. So it has to happen every after a period.
5 to 6 days after the period
After.
stops.
Okay. Yes.
Okay? And if you are no longer having period for any reason, in that case, first day of every month.
Okay.
And from age 20, all women must know their own breast. And if there's any change, they can spot it quickly.
Immediately.
And then go for
Help.
checking it out properly.
Okay. So that brings us to the other question. Why is it important, highly important? I think some women don't know. Why is it highly important for them to examine their own breasts properly? Yeah.
Yeah, so as I said, unless you examine yourself, you will not find the lump.
Okay.
Okay?
Yes.
And if you don't find the lump, by the time actually it causes symptom, it does not cause any pain.
Okay, so doctor, also, are all the breast lumps signify cancer? All the
No.
breast lumps?
There are other types of breast lump,
I
but
don't-
we will advise
Yeah.
that from age 20, any lump in the breast, consider cancer unless proved otherwise. And all you are
Okay.
doing it is by examining, find the lump, go and have a scan.
Every lump can be breast cancer?
Yeah, any of them can be cancer.
Okay. Okay, because
So
there...
would you take a chance with a car coming in front of you and standing in and hit you? No. And that's why do not take a chance with cancer.
Okay. So moving on to Miss Gertrude. So what fears do women commonly have after hearing the word breast cancer?
Of course, the first fear is death. Many people, not only women, think that cancer diagnosis is a death sentence.
Okay.
And this is because many people have not seen people surviving cancer.
Yeah.
As doctor mentioned, that breast cancer is a silent killer. So when you die, when you have it, most of the time women have a diagnosis when it's actually too late.
Okay.
And within 1 year, they have died. So people think that when you have a diagnosis, then what the next thing is death.
Yeah, sure.
And of course, they fear the treatments, for example, removal of a breast.
Of course, yeah.
And also even a biopsy, the way we have the word biopsy in our local language means cutting off a piece.
Yeah, of
Who
course.
would want to have their piece of fresh
Cut, of course.
So those
like,
things,
it's
people
something
fear
like-
them and then make them shun away from breast cancer treatment.
Okay.
Okay, can I just also add to that? The sad thing is in America or England, where I come from, breast cancer is common.
Okay, yes.
Breast cancer is the second commonest cancer in this part of the world, in Uganda, after cervical cancer.
Okay.
But breast cancer is the commonest cancer in the world. And every year, 2.3 million women develop breast cancer.
Yeah.
The difference is, in England, for example, or other parts of Europe or America, if women has got a breast cancer, they go for investigation early, they have full treatment.
And they
As a result, more than 95% women will go on to live 10 years and beyond without any problem.
okay.
And the difference in Uganda is, and this is the sad thing, is in Uganda, from the time women has got breast cancer,
They don't
more than 90% die within 1 to 2 years. And do remember, all this death in young age,
Too much
every
potential.
mother's death leaves 3 or 4
children are
orphaned.
vulnerable. Yeah. Yeah.
Okay, and that actually is because two things. One is lack of awareness.
Your awareness is
Also, changing in lifestyle, alcohol becoming common, fat food becoming common. We are seeing more fat women in Africa than anywhere else.
of
But
course.
also facilities. In whole of Uganda, which is not a small country, 48 million, there is one hospital, Mulago, can treat cancer.
Yeah,
And
no.
that is not possible for rest of the country to come here. It is not cheap and have their treatment. And that is, these three things are compounding and causing unnecessary death in this
in
country.
people, yeah, and in the country. So, Doctor, that's a very, it's a big concern that the government needs to look into so that everyone can access the services for cancer. So, moving on, Doctor, so can cancer be cured? And what are some of the treatment options that are available?
Breast cancer, as I said before, only a few minutes back, that in England or America or other parts of Europe, breast cancer diagnosed, more than 95% go on to live normal life.
Yeah,
But it needs full treatment.
okay.
And even in Mulago, there are many treatments are not available. I
Yeah.
was talking to somebody from Mulago. Now, even then, when you think of the treatment, first thing is to diagnose. The diagnosis, because it happens in a very young age, is ultrasound.
Okay.
Ultrasound is available everywhere, and why it is not being used? And if it is ultrasound is done, then take a biopsy with a needle, and that can tell if it's a cancer or not. Unfortunately, that is not available in all parts of the country except
Yeah,
Mulago.
it's not.
That is number one. Number two, mammogram. People talk about mammogram, but mammogram is not good enough in this country because most of the breast cancer are happening at a young age. And mammogram is no good for women below 40 years age.
Okay, yeah.
So 40 years on, mammogram can help.
Can help.
Okay.
Okay.
But below, most women are below that.
Yeah,
So
of course,
mammogram
and
does
they're
not
the
help.
ones having the issues.
And so that's the first thing. The second thing about the treatment. The treatment facilities has got to improve. The breast cancer treatment is removing the breast, but if you have got facility, you don't have to remove all the breast.
Okay.
But if you have got facilities, you don't have here, okay? And then treatment with drugs, which can be chemotherapy, or also many of the breast cancer in this country are hormone sensitive. That
Okay.
means you can give them tablets, which the women can take at home.
Okay.
Okay?
Yeah.
Now, also there are other treatments, many other treatments have developed, but I was speaking to somebody from Malago, is not available here.
Okay.
Okay?
Yeah.
The sad situation is, I was with another cancer survivor like Gertrude last week,
Okay.
and she had gone through a difficult journey, and the journey is not easy for women with breast cancer.
Yeah, of
okay?
course, it's hard.
So, but she's surviving, luckily, although she has got problems. But now she has got to take a kind of a tablet for keeping the breast cancer under control. Now, those tablets are very simple tablets, and they are not very expensive. But for that, she has got to come 5-hour drive to Kampala,
To get
stay
them.
2 days here. Nobody will prescribe her anywhere else, and she has got to come every month. Imagine.
That's a lot of costs involved.
And why?
Because
This is
they are not
unnecessary
available.
bureaucracy. Yeah, and those things has got to change, because you have got to think of these brave women and their families. Breast cancer journey, like any cancer journey, is not easy.
Yeah.
You have got to think rather than sitting on the top, well, we can't do this.
Okay.
That's not good enough.
Yeah. Okay. Also, doctor, what actually determines the survival of a breast cancer?
Surviving.
Yeah.
As
What
I said,
determines the
Depending
survival?
on the treatment available. Okay? Now, in a way, she is a lucky survivor. Okay? But for her, breast cancer, more than 9
Okay.
out of 10 has died. Okay?
Okay, so doctor, also what is advanced breast cancer and what happens like when the disease spreads? And also, is there a hope for people having this advanced breast
Even
cancer?
in advanced breast cancer, we cannot cure everybody. Okay?
Okay.
No, the medical profession is not for curing everybody. But we can actually comfort everybody. Even in advanced breast cancer, there are options to make their life comfortable.
Okay.
Okay, and that is not happening.
Okay. So, doctor, also as we are winding up, as a professional retired breast cancer surgeon, what is the biggest mistake women make regarding the breast health, like breast cancer health?
Can you repeat that question slowly?
Okay, as after like all the years you've been in service as a retired breast cancer surgeon, what is the biggest mistake women make regarding breast health, breast cancer? Still.
I don't want to blame the women.
Okay.
I want to blame the system. There is not enough knowledge distributed. I think channel like yours can play a huge important role. You are a woman yourself.
Yeah, of course.
You can play a huge important role in spreading the message that breast cancer is common, going up. It can be prevented by certain measures up to 1 in 3, and treatment can actually give a good result if it is done, diagnosed early and treated. And why don't we have more treatment available in the whole country? So you need to challenge your television,
norms, yeah.
need to challenge the parliament.
Okay.
Why don't we have the regions,
why-
why they don't have any breast cancer?
Yeah.
Why they've got to come to one hospital?
One hospital specifically for that. But thank you very much, doctor, for that insight. And also, Mrs. Gertrude, what is one myth you would like to collect today about breast cancer health?
I want to collect one myth that breast cancer is not a death sentence.
Okay.
And because we take it as a death sentence because many women are frustrated.
Yeah.
Yeah, of it.
Actually, one myth in the medical profession, they say women come late.
Yeah.
These women don't come late. These women come early. These women see the lumps at the lowest level, but the system
We have.
destroys them. By the time somebody gets through the system to get to where the treatment is,
Yeah.
cancer develops.
Okay.
We have seen many women who have been in the system, even have reached Uganda Cancer Institute. 6 months down the road, they've never got treatment.
Okay.
They have nowhere to stay, they have nothing to eat, so they get back and die. And then we put in the statistics that they come late. So that is a myth I want to correct today, that the women are not late. It's the system.
Also,
Let me ask you a question.
yeah, sure.
Now, as a woman yourself, you heard this. What's your reaction? What do you think?
Surprised,
Surprised or shocked?
shocked.
Yes.
Exactly, that's the correct word to use.
Yes.
Yeah.
Yeah.
Okay, so as we are winding up, Doctor, what excites you about like the future of breast cancer, since like awareness is increasing nowadays, and what's your last take about breast cancer for today's show?
Okay. Well, so most important to be breast aware. Start self-examination from an early age. Remember, breast cancer is a silent killer.
Yeah.
Not only look but feel. And also, if you find anything, report early to the nearest facility
Okay.
for diagnosis and then treatment. And
Yeah.
also push your politicians and the local team to so that facilities are more available throughout the country.
Okay. Yeah. Thank you very much, Doctor. And also, moving on to you, Mrs. Gertrude, what's your last take on breast cancer today?
My last take is one thing that is not always talked about is the supportive services
Okay.
to cancer care, especially breast cancer. You know, this is a journey that women walk for over 10 years.
Yeah.
So they are not supported, they are not given the right information to make informed decisions. And as an organization, we struggle with these patients. But they get most of the information from other people from the community, but the professionals don't give the information that they need. So we need to integrate supportive services, counseling,
Okay.
to ensure that these patients get right information, complete treatment, and they can survive.
Okay, from that same note, I think you should also talk about like this organization you are having, supporting women having cancer. And then if someone out there is receiving issues, they have examined and they found something and they want immediate help, like where can they find you?
Thank you so much. I'm a team leader at Uganda Women's Cancer Support Organization.
Okay.
And this is an organization of survivors. We are over 200 survivors across the country. We have survivors in all districts of Uganda, and we are ready and available to support those who are receiving cancer diagnosis. But also we work with experts like doctor to increase awareness in the community. But the challenge has been personal resources. We have not been resourced enough to do this work. So I'm just begging anybody viewing and is willing to support our work, support a TV program, support a community awareness, support a patient support programs. And now we are located at City Star House in 8th Street Industrial Area. We have just relocated. That's where we are, but we can be found even online.
Okay.
Yeah.
Thank you very much, Doctor. And as we are closing, we'd like to thank you, Doctor,
Thank you.
for the wonderful insights and also the discussion. It has been very impactful. And to you, our dear viewer, I think you've learned something about breast cancer today. And I think we would like to also encourage you to continue being on these programs, because like, of course, early detection and timely treatment, and as we have seen, these are something that you can get from here, and also like try it with yourself and find ways of helping yourself. So to our dear viewers, remember that awareness leads to early action, and also early action can actually save many lives. So thank you for being with us. This has been a wonderful program and wonderful discussion with our guests. Let's meet again tomorrow, same time, and have a blessed day.
Lu tenang aja.
Tujja kuba tukatandikirawo. Vijja bonenza akatuddemu nate nga bulijjo. Savage not average kuzo musamusamu nankina musamu kiramu mukyenda mukaaga. Tutandika butandisi ate nate mpolampola tosanye kubanga atookasibwa. So nga ate tuyitamu katono mu bye twasembye okola tusobole okumanya ate ebiki ebiddira ate nate.
Sama-sama ayo. Udah mau saya keras kepala. Kalau kamu masih sayang sama bapak, kamu duluan. Cepet.
Ini pasti ulah kamu kan, Mas?
Kali ini aku nggak tahu apa-apa. Ini ada apa kok? Penculikan apa?
Bapak enggak. Bapak masih sama mereka enggak? Tolong enggak. Kita harus selamatin Bapak sekarang.
Apa kalian yakin ini tepatnya?
Bener, Pak.
Kayaknya mereka udah milihin Bapak karena tahu kamu melarikan diri.
Target mereka itu Zara. Asal ibu tahu ya, Zara ini diculik karena dia
Itu adalah anak kandung Pak Bagas.
Kamu pikir uang
Yes. Tutandika butandisi ate nate mpolampola.
sama dia aja? Kenapa selalu berharap sama kita? Ya bukan siapa-siapanya dia.
Bino bye twasembye okubanga ate twekkaanya.
Pa.
Mukazi wattu yakutte kuba okujja okubanga ate asaba obuyambi. N'amugamba nti munange gweka gwe nsigazizza. Gwe nnyinza okusaba okunyamba.
Anak yang selama.
Anti muwala we gw'obadde onoonya okumala ebbanga epanvu nnyo Kamala wuuno atuuse. Kansubire ogenda kumuyamba munange taata. Bw'atyo Nakandi bwe yategeezezza wekkaanyiraba nnyo.
tentu Michelle.
Of course era Michelle ngenda kubanga ate muyamba.
Menyangkut bapak angkatnya Zara. Orang
Kubanga ssebo no taata we yamwadoptinga omusajja amukuzza okuviira ddala ssebo we yazaalibwa. Nina okubanga ate muyamba wabanga munange yeetaaga okubanga ate ataasibwa. Tutandika butandisi ate nate mpolampola tosanye kubanga ate okasubwa.
Terima kasih.
Anti munange neyanzizza. Bannange weebale.
Terima kasih.
Bannange weebale.
Terima kasih ya.
Mukazi wattu yeebaza.
Terima kasih, Pak.
Neyanzizza bannange onkoledde makula. Kyonkoledde kyamaanyi nnyo Kamala. Tutandika butandisi wekkaanyiraba nnyo. Era mukazi wattu bambi yasanyuka Kamala. Kale no tutandika butandisi tosanye kubanga ate okasibwa twolekeddeko ataano mu bubiri. Kaakati nno tukwate kuba okudda sayidi zeeno. Mukazi wattu Nulani yajja. Maama yali ludda agenda maaso n'okubanga ate akwasaganya Saara. Anti munange maama.
Apa, Nur?
Ate buzibu ki Nuuru?
Ini Zahra baru aja kirim pesan.
Agamba nti Zaara yakansindikira message.
Zahra.
Era ng'ayinza okuba ng'afunye engeri ey'okutaasaamu taata.
Masya Allah, Nur.
Katonda atu bannange.
Zahra
Kyotegeeza Zaara sente azifunye.
membebaskan Bapak.
Sente zisobola okutaasa taata azifunye. Anti era bwe kirabisenga.
Allah itu maha baik.
Ye Mukama Katonda nga wakisa.
Aja mendoa.
Omanyi mbadde n'akava okusabira taata.
Semua.
Naye ate Mukama Katonda essaala abadde yagizzeemu dda. Mukama Katonda weebale. Ono ali wano yekkaanya.
Kasihan.
Munnange Nuuru weebale. Weebale nnyo. Agenda okwetegereza. Ono ali wano ssebo abaddewo ng'ali mu kuwuliriza. N'akwata ekkubo yeeyongereyo. Anti munnange kambeere ebweru.